But can you tell me how the circadian rhythm, sleep, exercise, stress is affecting the actual ovarian pathophysiology? So maybe if I can explain that to the layman person, then maybe they'll be able to connect both together.
Because our hormones respond to the circadian rhythm,
So
to the
estrogen,
sunrises,
progesterone,
melatonin.
melatonin.
So there have actually been studies in late night shift workers, which included cabin crew on long haul flights and nurses doing night duties. And they found that the incidence of irregular periods, PCOS, endometriosis, difficulty conceiving, miscarriages were higher in this category. So, of course, there is an impact. In some professions, maybe there isn't much that they can do about it, but at least for people who don't have those kind of work commitments where they have to work all night, if they can try and reduce too many late nights, and like you said, eat in time, sleep on time, there's a
So you're saying when you do this, when you're aligning with circadian rhythm, the quality of the hormones are much better.
hormones are more balanced.
Balanced.
Yeah. And
Because infertility is a hormonal issue.
everything is a hormonal issue as far as fertility is concerned. If your hormones are balanced, it's like an orchestra, with so many different hormones that play.
It's a symphony.
It's a symphony. Yes.
It's multiple micromolecules are being
Yes.
engaged.
Yes.
And every molecule has its own circadian rhythm. That's the beauty of it.
Yes. And what is good is that the awareness of the impact of all these lifestyle factors amongst medical practitioners is increasing. And so we are able to educate our patients better about it as well. It's not just take this tablet or take this injection, it starts with lifestyle modification. You cannot skip that.
So we talk a lot about stress. So stress increases cortisol. Cortisol decreases the quality of estrogen and progesterone through these multiple interactions, and that hormone needs the ovaries to produce a good quality ovum. It is not there. Infertility, stress again, vicious cycle.
Yes, so stress plays a role in many indirect ways as well. The direct connection, in fact, has not scientifically been conclusively proven. But when couples are stressed out, you just imagine a couple that has got a very difficult job, high stress levels. A lot of times they are not even able to have relations at the time of ovulation. They're just too tired, or one is tired, one is not. Their marital life is taking
It becomes a chore.
It becomes a chore. And as I mentioned, when they are stressed out, they are more likely to eat at erratic hours, eat the wrong things, and also reach out for that extra cup of coffee, for that, one glass of whiskey or alcohol just to calm them down, smoking. So, which then again comes down to our lifestyle factors where all these things are concerned.
In this time, besides age, what are the other lifestyle thing that a woman should do or a couple should do in case they are going through infertility issues?
So, there is a huge impact of environment and lifestyle on our general as well as reproductive health for both partners, actually. Fertility is not just a female issue. In almost 50% of cases, there is a sperm factor involved as well,
50%. Wow.
which they may not be aware about.
But usually women are being blamed a lot more, correct?
That's
in
it.
your practice.
That's sadly what is still happening. Men are sometimes reluctant even to get a semen analysis done, but we are seeing that changing now. There are times when we've even had single men, come and say, I'm about to get married. I'd like to check my semen quality first.
Huh.
Yeah, that's refreshing to see that kind of
Is
awareness.
it right?
It is right, yeah.
Huh.
So they want to.
Oh, so we can assess the quality of the semen as
yeah,
well.
we can do a semen analysis for them.
So
at
instead of
least.
astrology, they should do this before marriage.
They should. They
Right?
really should.
They should check the ovarian reserve, they should check the semen analysis.
There are so many tests that they should be doing. Well, astrology, I'm not going to dismiss it completely, but this is equally important as well. And we'll come to the genetic issues in a bit. But yes, we're talking about the lifestyle and the environment. First of all, what I feel, unfortunately, obesity is becoming like a pandemic.
So obesity plays a role in
It
infertility.
plays a very big role. When the BMI is too low or too high is what we find more commonly. Too low is a little rare. It impacts egg quality and sperm quality. It reduces the chances of implantation. It creates hormonal imbalances. So it's very important to try and achieve a normal BMI, which is between 20 and 25 kilograms per meter square. It's not always possible to achieve that, especially for people who have a very high BMI. But at least they need to make a start somewhere. Even if they lose 5 to 10% of their current body weight, it shows a significant improvement in their chances. So sometimes what we do with couples who are of a very high BMI and we know the clock is ticking, we tell them, do the embryo freezing, focus on your weight loss, and then do the embryo transfer. So you're at least conceiving at a time when you are in a much healthier state. And then we always try to emphasize that this normal BMI, they have to try and achieve with the help of both exercise and diet. Exercise is so lacking in our generation. A lot of the health problems are due to what we call a sedentary lifestyle, right? What makes it worse is the misconception that couples have that when they are trying to conceive, they should not be working out. They just stop working out. Women just stop working out.
Or because it may interfere with...
They quit their jobs, they start sitting at home, they start taking bed rest, but they're reducing their physical activity even further. What I tell them is that if you see our grandparents' generation, they were so much more physically active than us. Most of them stayed in rural areas. They went walking. They did everything manually, washing clothes, filling water from wells. So in our grandparents' generation, it was very common to have large families, 4 children, 6 children, some had 8. In our parents' generation, my mother is 73. She goes grocery shopping, walking every day. She goes to the dry cleaner, walking every day. She doesn't miss her morning walk, evening walk. So our parents' generation was fairly active as well. They also conceived without much difficulty. 2 or 3 kids, most of them had. We blink it. We
Yes.
don't even go. We don't go anywhere. We sit in our chair and we take an app, Swiggy or Blinkit, and we order our groceries. Our day-to-day activity has become so limited that what nature designed our bodies for, the level of physical activity that we were designed for, we're not even doing a small fraction of it. That's why it's very important to, in your day-to-day activity, if you can increase, your step count, etc., it's great. But also work out. It's very important to work out. You cannot skip exercising. Even if your BMI is normal, you should not skip exercising.
Even if you look normal.
Even if you look normal.
How does exercise helps in IVF outcomes?
First of all, exercise is the most underrated stress buster. It releases endorphins. It makes you feel good. It gives you a sense of accomplishment. You start your day with a good 1-hour workout. It sets the pace for your day. And we know that stress levels are high. That's another factor that's contributing to couples having difficulty conceiving. So exercise is great for your general physical health and your mental health both. So even people who have a normal BMI should still be exercising.